This is module 1 of the VMSG training. We have a series of presentations and videos just running through the software system that we want to implement and use for effective results throughout the health department. So this is the dashboard, or well, the quick menu. And so the screen that you're looking at is pretty much what you'll be seeing as soon as you log into VMSG. So I'm going to run you guys through these couple of icons here just on this first page. The other videos, modules 2, 3, and 4 will run through the implementation part of things. So looking at this first one, the dashboard, also keep in mind sometimes VMSG does take a couple of seconds to run and get to the requested pages. So this page is really how things look or stand at a glance. Currently, we are in the leaders page or tab, and so here you can see all the leaders with all of their activities because we are in the activity level. It might look a little chaotic at first, but it does, once you get into it, it does get a little easier. So with us being in the activity level, here we can see we have about 76 activities in total, divided up in groups by these leaders. 74 of them are red, mainly because we might not have started or finished these couple of activities. 2 of them are completed. Here you can switch to the groups. So I'm just going to click on that to show you. Right now we just have the strategic plan. We are also in the strategic plan group. So if I did change my group to the department level, which you are likely to see, this is a quick shortcut to get to that page. And here we see that the department is the first level, right? So there is somewhat a hierarchy with the software system, and I'll show you from an infographic how we do want to look at it. But Cattaraugus County Health Department in this level is pretty much the parent group of everything else. So let me just pull up this page. So when we think about parent levels, really what we see in VMSG is that Cattaraugus County is always the level 1, right? So it's the first group. Cattaraugus County Health Department and that group, or the group Cattaraugus County Health Department, is the parent group of the CHIP. And then you'll also see that the CHIP is the parent group of the strategic plan. And that's pretty much how things look at or in VMSG. So just going back to our VMSG. So here you can see Cattaraugus County is the parent group of these guys. We're still in the activity level, so here we can see we have about 334 activities, right? 202 of them are red. We have about 132 that are green, meaning they've been completed. If I go to the objective level, here we see we have about 130 objectives, right? So 65 of them red, 65 of them are green, and we're still in the groups. I can always change it to the leaders if I want to see who is in charge of which objective, right? And that's going to show pretty much a summary in this block over here. And the same with the goals. The goals won't have assigned leaders to them. So for this, we would mainly be working with the objective level and the activities level. So here we see the 2 leading groups at least. All right. And that is pretty much it for this first page. Really, what we want to keep in mind is that there are always parent groups for each group, right? And they all stem from the level 1, which is Cattaraugus County Health Department. Going back to our main menu, and this is the icon that you want to click if you want to get back to this page. The quick update, I'll go into this. This is really going to be a summary of the activities that I've been assigned to. So right now I'm part of the Tobacco 2023 training group. This was really just a test. And so all the activities that my name is, tagged under would be in this block over here. So again, it's like status summary of things that I'm involved with. That's pretty much all for that one. Users, this is pretty much the health department's license, right? So we have everyone that is at least working as, supervisors, managers. They would probably and most likely be one of the staff having a license, right? And what I do want to point out is the reports to. So this is, of course, the person that you would report to. And again, that's pretty much all. If we do want to add or delete users, this is the add icon. And then if we want to delete a user, this is the delete icon. Going back to that first page, now we're at partners. Of course, these are just all of the partners that we have affiliations with in Cattaraugus County Health Department. This is what I do want to point out. So adding partner contacts, we don't have them right now, but we could very much have them. And so again, if we do want to add partners, here's the add icon, and delete partners, delete. Going to the document management, this is really a page that you're probably not going to be using yourself. Instead, what we want to do to get to the documents, because this page is really to search a document. So if you were to look for a certain page or a document, this is where you would search for that. We don't have much in here. We only have a test. But the real way we do want to do this is by the group. So if I was to look to find a specific document that's part of a specific plan, so say the strategic plan, I would click into the strategic plan, and all I would do is hit this folders icon right here. I'm probably not, yes, we don't have anything right now, but this is where you would find the documents related to the strategic plan. And this is also where you could add documents related to the strategic plan. So if you wanted to add documents, you would have to find it by the group and then add, because if we do go to this first page to find a document, we could only find documents here. Hold on. Okay, so we're still in the strategic plan or strategic level. So what we do want to do is change our group again. Again, the hierarchy. And if I go to it then, I won't be able to add under here. Okay. So again, go by the group. Find the group, strategic plan, and then the documents icon. Okay. Going to the next one, the categories. So not everyone has access to this page. This is really a way to tag different things. It's a place to add categories and subcategories. So if I did want to add a specific category, so here you can see we have service types, requirements, funding types, essentials of public health. We can add categories here, and we can also add subcategories, right? And that's here. So it's divided up to 2 pages. And that's really all for this page. Again, not everyone has access to this one. Going to passwords, really this is just to change your password if you did have to do that. Settings, this is mainly an administrative page. So again, it's one of those pages or icons that you could pretty much ignore. Help, of course, with this one, it also goes by categories, right? So if I'm looking for something related to document management, I would click on document management and it throws out a couple of options and findings here. Going back to the first page. So reports. With reports, we do want to keep in mind that whatever is down in this group, similar to the previous documents folder, we do want to make sure that we are on the level that we're, our intentions are for. So if my intentions were for the strategic plan, I would have to change my group first, right? So change my group, and then I would go back and reports, right? So see down here, I can see strategic plan. So just make sure to keep an eye on this. But yes, and then we have different categories: operational plan, partner activities, team lead reports, partners, categories. So it's really dependent on what you are looking for, and just keep in mind your group. Organization will always stay the same, but your group can change. Going to the export operational plan, specifically with CSV file. So I'm not going to click on this because it does take quite a while. What I do have is a screenshot related to this. Exit out of this. This is really what you will see once you click that, right? And then you can export your data to an Excel spreadsheet. And again, I'm not going to click into it just because it may take quite a while. Let's just make sure I don't have, okay. And exit out of that. Okay. Getting user emails, right? So this is just all of the users within VMSG. So this will always only be 20 users. But if you did want all of those emails, this is where you would find it. Going back to that first page. Service requests, this is really, again, administrative. Most of it is related to users. So new user, move users, replacing users, removal. But then also if you do want to request any other services, this is where you would do it. And then we have the last two. So these two are really related to the website and the things we want to post on the Cattaraugus County Health Department website, right? So I'm going to click into these. This is pretty much what it looks like. If I do want to click into it and export certain things, and these you create yourself, right? So if I do want to look at, so this is what it would look like. Some of them obviously have more. We can try and find one that has more. Let's do, okay. So again, these are just the URLs for the websites and the website usage. I'm gonna go back to the first page, show you. Okay, so here was a test that we did. This is what the link would look like if you did want to copy, and add it to. This is what it would come down to, right? And these are the things we want to be posting on the Cattaraugus County Health Department website. So again, these two icons are really to create those URLs. It's dependent on the objective level. So you do want to go to the objective levels. We'll use the strategic plan. And then this is where you would find it. So once you click this is how you would ultimately create those links. It also takes a while, but yeah, this is it. And then this would appear at your icons here. So if you do then end up clicking into this, this is the managing, and then this is the creation. So that is pretty much it for the first page, or the first module. The next modules go into the goals, objectives, and activity levels, and how to create those for effective results.